Welcome, everybody. Thank you so much for joining us today. I am Michelle Morris with Consolidated Planning Group. Today's webinar is scheduled to last for about an hour, so grab a drink and a snack and get settled. People are still filtering in, but I want to let you know that first of all, this webinar is being recorded. Later on today, we will send you the slides and a link to the recording. And if you're listening on our podcast and you would like a copy of the slides, you can just email us contact@cpgcares.net and we will get those slides sent out to you. So you'll receive the slides and the recording later on today. Since we're in webinar mode, we cannot see you or hear you, but I do see the participant count, so I know that you're out there. If you have any questions or comments, we love that. And we would love for you to put those in the chat box. That way I can keep an eye on what questions are coming in as Lynsy is presenting. And I'll let her know when we have questions for her. So again, I'm Michelle Morris from Consolidated Planning Group. We are a financial planning firm that focuses on families with special needs loved ones. We're based just outside of Houston in Sugar Land, Texas. We serve families all across Texas and all across the United States. And people come to us for things like protection plans, lifetime care plans, transition planning, when your child turns 18 and they become an adult in the eyes of the law. There's a lot that changes at that time. We help with ABLE accounts, and we are here to advocate for families and to educate families. One of the main reasons that we do what we do is because the owner of our company, Allison, and her husband, Jeff, have 4 kids altogether, and 2 of them have special needs. So when Allison was going through this kind of information with her own children, she said, this is really difficult and really confusing. And I've been a financial advisor for years. It shouldn't be this hard. And that's when she decided to take the company towards this education and advocacy track to work for families who have special needs loved ones, so that it will be easier for you than what she had to go through. As a matter of fact, according to the Bureau of Labor Statistics, there are over 263,000 financial advisors across the United States, and fewer than 200 of those, not 200,000, just 200 period, focus on special needs planning. So you are definitely in the right place when you're with us. Fewer than 0.1% of all the financial advisors in the United States know and understand what it takes to plan for the future of a special needs loved one. And we live it, sleep it, breathe it, and it is our passion. So again, I see that more people have come in, and I'm going to kind of remind you maybe in a few more minutes, Lynsy, once you get maybe 2 or 3 slides done. This webinar is being recorded. You will receive it later today in your email. And if you have any questions or comments, please put them in the chat. All right, so without any further blabbing from me, I am so happy that you're all here, and I'm so happy to introduce Lynsy Meier, who is with Sevita and can help us understand more about HCS waivers. So thank you, Lynsy.
Yes, ma'am. Hi, everybody. My name is Lynsy Meier. I work for DNS Community Services. We are now a part of the Sevita family. We were purchased by Sevita about 2 years ago, about 2.5 actually. And we have been learning a little bit more about services throughout the United States, because we've always just been based in Texas, and Sevita is a nationwide company. So it's been a nice transition. But I have been working in HCS for over 15 years in all different roles. And I'm happy to share some of the information that I've learned over the years with you guys. Next slide. So what we're going to,
Is there?
I'm not sure if that's supposed to be part of the presentation. So this is, go down to the next one. I'm sorry, Michelle.
We have the waiver programs.
Yes.
And who can receive them and what you need to know about it. And then home and community-based services.
Yes. So I can still share the information. This slide deck is just a little bit different than the one I was thinking we were going to go off of today. But that is
Okay,
totally
no worries.
fine. So what we're going to talk about is the actual HCS program. So there are lots of different Medicaid waivers out there. Every single county is attached to what's called a LIDA. We used to call them MHMR office, and they've moved to new terms called LIDAs. So at the end of this slide deck, you'll be able to see which LIDA you are attached to if you have any questions or you need to reach out to them. But we'll talk about who qualifies. We'll talk about just HCS in general. So there are several different Texas waiver programs. Like I've been saying, HCS is the one we're going to focus on. There's also the CLASS program. There's the deaf, blind, and multiple disease program. There's the MDCP, the medically dependent children program. There's STAR Plus, there's Texas Home Living, and there's the YES program, which is youth empowerment. So if you do not have an HCS slot and you're joined this webinar, but you want to see if there's any other services available for you, this would be an opportunity to kind of note which programs are out there and call your LIDA representative to see what you may be able to participate in, because the HCS program is probably the most integrated that Texas has to offer, but it does have a very long wait list of 15 to 20 years. So hopefully most of you on this call already have your HCS slot offered for your loved one, and you don't have to look into any of these other services, but just in case, these are some options out there that have shorter wait lists and possibly no wait list at all. If you have one of these programs, you would have to give up, hold on, let me say that differently. You can only be on one waiver at a time. So you have to kind of balance out which one makes the best sense to give up one to accept another if you are lucky enough to be offered multiple choices. So you can receive waiver services if you have an IQ of 69 or below, if you have any kind of deficits, if you have Medicaid benefits, and if you're not enrolled in another waiver program like I had just mentioned. So what trips people up sometimes is that you start talking about Medicaid, and lots of families say, oh, well, I don't have Medicaid. I would never qualify for this. But the individual qualifies as their own person, and they receive Medicaid along with their slot and their Social Security. So it all kind of comes in a nice package.
So people are able to work and still get these benefits. And the income limit for Medicaid is different. It's much higher than the income limit for SSI. So even if maybe a person doesn't qualify for SSI because they make too much money, is it true that they can still qualify for Medicaid and these waiver programs?
Yes. So the main point of having the waiver and qualifying for Medicaid is having less than $2,000 in your, not really in your bank account, but in your complete package of finances. So like we do have occasionally somebody as a parent would leave their home to their special needs child, and that home is actually considered income. So then, you know, that wouldn't let them be able to qualify. So there's lots of different things, and that kind of is a plug-in for CPG and things that they would be able to really help you with to make sure that you get things where they need to be. There's special needs trust and all kinds of different ways just to make sure things are protected and you qualify for your Medicaid.
Thank you. I was actually going to bring that up, you know, because if you can't have more than $2,000, how on earth are you supposed to save money as a person with a disability or a parent save money for their children. And we can definitely help you with ways that you can put money aside that are not counted against the individual for their waiver, Medicaid, or SSI benefits.
So how do you know you need a Medicaid waiver? There's no systematic way of informing families. Some school districts do a wonderful job that whenever you get into school, you are able to, well, everybody has an ARD meeting if they have a special needs loved one in school, but not every time does that ARD group go into the Medicaid waivers and talk to you about that. So some schools are really educated and really know how to share that information to get you on that HCS list right away. And some school districts just don't know enough about it, or they don't. I'm sure they would think it was very important. Every school I've ever spoken to has always wanted more information to be able to share with their families. It's just not always really information that's out there for everybody. And like I had said before, there's over 170,000 people on the HCS waiting list in up to 20 years. So the best time to get services or apply for services is right away, you know, at that initial ARD in elementary school, so that the services are available by the time that your loved one is an adult.
You know, are there any programs in the works to lower that 20-year wait?
There are a couple of things that are possible. There's called a nursing home diversion slot that can kind of get you in outside of the general list. So if your loved one lives with you and they have high medical needs and you can't take care of them the way that you really want to, and there's nobody else in the family are able to take care of them, and you would have to go the route of putting them in a nursing home. Sometimes these are children that are having to go and live in the nursing home, which is really hard. But not always can you meet those significant needs. There are options to get a diversion slot, to find a host family, to find a group home, just lots of different opportunities to get that slot to not have to live in a nursing home. On the exact opposite side, there's called a crisis diversion slot, which is the opposite of being medically significant medical needs. That's high behavior needs, like maybe your special needs loved one is having a really hard time living in the home and maybe is being very aggressive to siblings or parents. It's sad sometimes to hear some stories that people really struggle with, and you just can't, you know, take care of them in the home. There's the opportunity to get that waiver for somebody that's in crisis.
Okay, great.
So if you want to know any more information on who qualifies for HCS, you can go to this link or click on that QR code. It'll take you to the Health and Human Services website, and there's more information in detail to go over. But the best way to me to get information is just to talk to somebody, and that would be your local LIDA MHMR office. So getting into the nuts and bolts of HCS, HCS is a Medicaid waiver program for Texans that have intellectual disabilities or related conditions. So Texans is an important thing. Sometimes people move out of the state. HCS does not follow you to another state. You would have to apply for benefits in their state. So HCS is a Texas-based program.
There you go.
So whenever so you have your HCS slot and you're having to make a decision on which direction do you want to go. Do you want your loved one to stay at home with you? Do you want your loved one to live in a group home? Do you want your loved one to live in a host home? Now, that's probably when you get the slot and the service coordinator calls you with the packet and you're going to do an enrollment meeting, that's probably the biggest important decision that you're going to make. And the best thing that I think about HCS is that it is a fluid program. So say you choose group home today, truly, as soon as you can get a meeting scheduled next week, tomorrow, whenever, you can change it to supported home living. If that doesn't work, 3 months down the road, you say, okay, that wasn't a good option either. We're going to try host home. So the plan is very fluid. You can add, you can take away, you can make changes at any time. Usually there's an annual staffing completed after you do your initial enrollment, but there are revisions to that plan throughout the year, and you can make all the decisions that you need to based on what's going on in this moment. A residential group home sometimes gets a little bit of a bad rap, truly. Some providers do them really well, some not so much. I would say with us being one of the largest providers across Texas, we have a pretty tried and true plan. We have group homes that serve 3 individuals who live in them. We have group homes that serve 4 individuals that live in them. We do have programs that are stronger than others, I'll be honest, because the most important thing to know about living in a group home is it's probably only as good as the staff members serving the home. So a group home, each individual who lives in it has their own room. They share bathrooms and common spaces, and there is 24 hours a day, 7 days a week support staff who rotate throughout the home. So what you tend to see is when the favorite staff are there, it's going really well. And sometimes there's maybe someone who isn't liked as much and it's not the favorite shift. Most of the time, like I said, it's really great, but I'll be honest always that is probably the biggest challenge of living in a group home is having that staff that are doing the right thing all the time and really making sure that everybody is getting out into the community, working on their training goals. The home is kept clean and organized. They make meals in the group homes, and usually in our company, each home has its own vehicle so that there's easy access to get out and go, get people to work, get people to their day programming. So like I said, group homes sometimes can be a little bit tough to wrap your brain around, but the best thing to do is just visit the homes, talk to the providers, really know what's going on so that you can make that decision. The next option that I want to talk about is supported home living. So if you say, okay, no, my loved one will never live in a group home, they'll stay at home with me, or they want to live in their own apartment because they can pretty much do a lot of things on their own and they're safe. Or, well, they're not going to live with me, but they're going to live over here with, aunt, uncle, cousin. Supported home living can be a really amazing option. So what that means is the service coordinator will do a plan with you called a PASS-HAB plan. And they'll talk about what personal assistance is the PASS side, what you need help doing by a staff. And the HAB side is habilitation, what you can do yourself and what somebody can teach you how to do as you work together. So when the PASS-HAB assessment is done, they determine how many hours a week somebody can come into the home and work with you in your home, take you out into the community, and you make a plan by that. So there's so many things that your attendant or your staff member who comes into the home can help with. And the plan is set up based on what you need. So if you need help with bathing, if you need help with meal prep, if you need help with medications, if you need help, with cooking, cleaning, all of those kinds of things that staff can help you with. The other side of it is the staff usually has transportation, or we can transport you where you need to go and the staff meets you there. And you can get to doctor's appointments, you can get to the grocery store, any kind of community activities, any kind of work program that you're part of, or competitive employment. That's what the great thing is about having a PASS-HAB staff. And the cool thing that I always thought whenever I was in the position to work with this directly is a lot of times families would come to us and say, this is who I want the staff member to be. And we will just hire that person that already knows the loved one, and they will work together to make sure that all of the needs are met. And it's not a stranger, because sometimes that can be the scary part is, well, I don't know if I want a stranger coming into my home. You can actually choose somebody that you want as long as they don't actually live in the home with the individual being served. And then what I focus on most of the time this last year, of my employment with DNS. Like I said, I've been with them for many, many years, but this last year, I have moved into a role where I focus on host homes, and that has been really, really fun. I help find host home providers and pair them with individuals who need a host home to live in, that don't want to live in a group home. Maybe they don't have a family member available. They can't live on their own, but they just really want to live in a home environment. Well, there are a lot of host homes that will open their home to people. You can have up to 3 individuals living with you in your host home. And we try to make sure, if you want more than one person, obviously they would each have their own bedroom. And we try to match personalities and ages a little bit, just to make sure that it feels like a home environment. It doesn't become a group home feel. But another side of that is, we find host homes to put individuals in, but the parent or the family member can also be the host home provider. So this is a cool opportunity that if your loved one lives with you and you want to take on the role as the host home provider, that would just mean you contract with us. The funds are tax exempt, which is my favorite thing to probably share, because the federal government gives us so little that we can share that we do get a little bit out of this program, that they don't charge taxes on the daily rate for host home providers. So you get a little bit of money for taking care of your adult child. I do need to say that if it's a parent, a natural parent, the only way that you can be the host home provider is if your child is 18 or over, because when they're a child under 18, of course, it's our role as a parent to take care of them. But once they become an adult and you choose to continue taking care of them, you can qualify to be a host home provider. And like I said, there's the daily rate that you get paid. And it may feel, I've had people tell me before, well, I don't know if I want to be the host home provider because it doesn't seem right to take money for taking care of my child. And I always say, hey, it's tax-free money. You can put into an account, plan it as your vacation that you take your child on every year, or do something special. It doesn't have to be looked at as income. You can just make it look at as something that you do special with your child for having them at the home.
So if you wanted to have your own host home and you have your child, how many other children or residents do you have to have, or are you allowed to have? How does that work?
So you can have a host, your home can become a host home with only your child. So the only one is all that you're required to have to be a host home. Your child has to live under the same roof as you. So it's a 2-part question. I'm going to give an answer. Yes, because I'm just thinking about it. So sometimes people say, oh, well, I have a garage apartment, or I built this other house on our land to take care of my child. So they have to actually live under the same roof. It has to be a connecting roof, a roof line. So if your garage connects and you can make that all one home, it probably will qualify. But if not, then it wouldn't. But the second part, to answer your question, is you could take care of your child and 2 others, or you could take care of just 2, or you could take care of a 3, but 3 is the maximum. And you could serve 3 people that are not your child at all. And if you're interested in doing that, I have a little plug for that at the very end. Contact me. I'll get you all set up. We'd love to grow our host home program and have great family homes for the individuals who are looking for one.
Fantastic. And there are some people who are asking about how you get paid if you decided to do that, how many hours and what is the rate. We have one person who responded that it's a daily rate based on the level of need. So how does that work? Yes.
Okay. So the level of need is determined at enrollment and at change in care. So whenever your loved one gets a HCS slot, if you guys already have one, you probably remember the service coordinator coming out and doing a very long packet called an ICAP with you. And in the ICAP packet, they ask very, very specific questions, down to, can your child turn a door handle on their own? Can they eat on their own? Dress? Can they climb a 6-foot ladder? It goes through like every single scenario. Can they make a list. Can they shop? Can they tell time? Can they, understand the difference between day and night? So it determines the level on very specific questions on what all you can do with your daily living activities and also just independence. And then there's another piece of it that talks about the behavior challenges your child may exhibit. And it'll talk about that and how often. And whenever you put that all together, you add it into, honestly, a dinosaur program that looks a little intimidating, but it's not. You put all this in and it just, calculates a level. And there's a level 1 is most independent. A level 5 needs a little bit more independent, a little bit more assistance, but still pretty independent, maybe has a behavior challenge a little bit. But for the most part, not a lot of medical or behavioral needs. When you get to a level 8, that means that your loved one probably needs a little more hands-on assistance. If they were to live in a group home, that's where a few extra staff hours could come in, where there's a second staff maybe for bathing or outings. So level 8 means, just a little bit more significant needs. And then since Texas doesn't do anything in an order we can understand, it would be nice if it was just 1, 2, 3, 4. We go 1, 5, 8, 6. And when we go backwards to 6, 6 means it's the highest level that you can be rated before you're considered one-to-one care. And level 6 is usually pretty significant medical needs, maybe total care and requiring a wheelchair would be, maybe needing a G-tube, all of those kind of major medical, but also it could be the very significant behavioral needs where you need maybe a second staff to help. You just need a lot more care. Is a level of need 6. And then if your loved one needs level of need, what they call 9, so we're going back up in the zigzag order, level of need 9 means 1-to-1. So of course, if you're 1-to-1, you would only qualify for a group home, or because supported home living and host home probably, well, maybe not say only, let me refresh that. Likely you'll need a group home with that staff that rotates to get a break. Lots of host homes and supported home living homes can't support having 2 people available at all times for those needs. So anyway, okay, so then, sorry, I get a little distracted. So then once you have your level of need, 1, 5, 8, 6, or 9, then for host home, there's a rate that goes with it. Our company pays the full daily rate that Texas gives. And I'll be 100% honest, Texas is probably the second to last on the list of states who really take care of their special needs loved ones. So our rates are on the low side compared to a lot of the other states that I've learned about being part of Sevita. So they range from $47 a day for a level of need 1, and it's $92 a day for a level of need 6. So for a 1, it's 47 and some change. For a 5, it's 50.84. That's the majority of people's level in a host home. And then it goes to 69.19 and then 90, maybe it's 94, something like that. But that's about where we're at on the daily rate. And then of course you also can use some Social Security money to help pay room and board expenses. So once you've made your living options choice, that big, huge, where does my loved one live? Then you have lots of other decisions that you get to make. As if you weren't stressed out already, then you have to say, well, what support needs need to be met? So for HCS provider, it's really nice. You're always probably going to get a case manager and a nurse as part of your team. So you would be the guardian or the advocate. Your loved one is part of the team, the service coordinator through the LIDA MHMR office, and then a case manager and a nurse are kind of the primary team that helps make these decisions and answer any questions you have, adds the services, takes them away, increases them as needed. So just kind of throwing that out there, you have those services in the home. Another decision that you'll make is, where is my loved one going to, what are they going to do during the day? So they're at home, we're hanging out, they're out of school, they're an adult. There are places that have adult day centers, and we used to call them day habs, day habilitation, but the adult day centers, starting on March 1st, changed the name to individualized skills and socialization centers, so ISS centers. So ISS can be done in the home if your loved one has a doctor's note and you're not the host home provider, but another person in the home. It can be done in the home if the person is medically needy, behaviorally challenged, or retirement age. The doctor can order that and it could be set up, but that's the least likely or the least maybe favorite choice whenever we are surveyed by the state and they come out and look at how we're setting things up. So an ISS center where you go and you get to socialize and learn skills and really get out into the community is where we really like people to go and integrate and just, grow with each other. So that's an option. And that's usually 5 or 6 hours a day, 5 days a week, typically Monday to Friday that they're open. And there's ISS centers throughout the state. So sometimes your center could be attached to the provider that you choose. Sometimes the center could just be one that the provider contracts with. But these are all things paid for on the plan, so there's no out-of-pocket cost. Behavior support is another one that a lot of people are interested in. Behavior support can be done in 2 different ways. You can have a behavior support plan that the staff or the host home provider are trained on, that a BCBA, a board certified behavior analyst, writes after doing interviews and observations. And the other side of behavior support could be going to an actual behavior center where a BCBA works one-on-one directly with your loved one. The key to that is I'm saying BCBA. So a lot of the behavior centers have the BCBA that works with you 1 hour a week, and then they have their technicians do the rest of it. But the only thing billable to the plan is the part where the board certified behavior analyst is doing the work. So just be careful if you want to send your loved one to one of those centers, because that's the only way that it's billable through the plan. Do we want to stop for a couple of questions, Michelle?
Yes, we do have some questions coming through. So who do you find out who your case manager is? I already kind of took that one. I said when you sign up for your waiver and your name comes up on the list, finally they'll assign one to you. That's correct?
Yes, so you'll choose your provider and the case manager would work for the provider.
Okay. Therapies. Can you use your HCS waiver to pay for therapies, or do you use private insurance?
So therapies is actually on my list coming up in just a minute, but I'll just go ahead and skip over and we'll start with that one. So physical therapy, speech therapy, and occupational therapy, and dietary, which sometimes gets forgotten, can all be added to the waiver. The trick is Medicaid, for all of these services getting added to your waiver, Medicaid has to deny it first. So if you go to the doctor and you say, my loved one needs physical therapy, and the doctor says, okay, I'll order it, and they send their referral over. So they're going to send the referral over and you're going to start therapy, and maybe 10 sessions are covered by Medicaid. That has to go, you have to go through those first before you can add it to the plan. So Medicaid essentially denies the service after those 10 sessions. Then you can go through and add the service to the plan and it covers it from there. Now the caveat to that is the therapy center has to agree to contract with us, because anything that we put on the plan, we have to have a contract, because the rates for HCS that we can pay versus private insurance pays, I mean, it's probably about half. So if the health insurance or Medicaid is paying the provider $150 an hour, this plan is maybe going to pay $75 an hour or whatever the state has it capped at. So most providers, including ours, we don't take a piece of that where we say, oh, well, Medicaid will pay and I'm guessing at this number, so I don't have this memorized, so you guys don't hold me to it. But say Medicaid will pay, or the plan will pay $70. Well, we'll only pay $60. That way we still make $10 per hour. We don't do that. We pass over the entire rate to the therapy office. So you may then have a copay, or you may say, well, who do y'all contract with, and go somewhere where it's no copay at all.
And does that also cover mental health services? I know you mentioned behavioral support, but.
So behavioral support is, I mean, mental health is tough, because where do the behaviors come from? You know, probably a mental health diagnosis. So many of our loved ones that have IDD have a dual diagnosis of some sort of mental health diagnosis. We see that more and more as time goes by. Now, mental health services is not included. Behavior support is truly to help decrease a challenging behavior. So say my behavior is that whenever I see my sister, I can't help but smack her. I mean, just so the behavior.
Well, I mean, we all have those. Everybody has those kinds of siblings.
Maybe I grew out of that. We'll see. But if, you know, if you have that happen, like, gosh, she's just so aggressive to her sister, I can't figure it out. The behavior analyst will come in and they'll do interviews, what's going on before, what's going on after. They'll do some observations. They'll write a plan that will help you do certain things to help decrease those challenges, to try to get to the goal of, when I see my sister, I don't smack her. So that's really what we're talking about when we're talking about behavior support. Mental health is kind of in a box in its own. Most LIDAs, MHMR offices, they have the IDD side of their center, and they have the mental health side. And when you need mental health support, usually that's a separate service. Like if you would need to go to a psychiatric hospital for stabilization, for example, our side on the IDD side would have to consult with them, and the mental health side then finds the center and does those evaluations.
Okay, great. Let's do one more and then we'll let you go back to your slides. So this person was told that they have to go through private insurance first, and then Medicare, and then Medicaid, and then HCS can pick up whatever's left. Is that pretty much how that works?
Yes. You know, unfortunately, sometimes when you have Medicaid and a Medicaid waiver, sometimes having private insurance is a negative. I've actually recommended that people drop their loved one off of the private insurance when you know you have your Medicaid, because Medicaid is pretty all-inclusive, and private insurance can sometimes hinder the services that you can get. You wouldn't think that'd be the case, but it is true. The waiver is always going to be the payment of last resort, so to speak. So you have to kind of check all those boxes first. But yeah, I would, you know, maybe consult with CPG. I'm no expert on that, but I have had to tell people that sometimes, that unfortunately, especially with psychiatry services, sometimes the private insurance does hurt more than it helps.
All right, continue, please, Lynsy.
Okay. Will you go back to the other slide, Michelle?
Oh, I'm sorry.
I'm sorry. No, you're okay. I was just going to talk, and I'm going to try to speed it up just a little bit and just give you a little insight on what some of the other services you can put on your IPC. So it's really important to mention dental treatment. So when you get your waiver, you have $2,000 a year to use for dental treatment, and that is cash money. So you choose the dentist. It's no longer considered a Medicaid dentist, because most people, well, all people, when you turn 22, you lose your dental Medicaid. So if you're under 22 and you have a waiver, you have to use your Medicaid dental. When you turn 22 and you lose that, you can have $2,000 of cash on the plan to pay any dentist that you want for all of the different treatment plans, cleanings, exams, and x-rays. Adaptive aids is probably what I wanted to talk to you guys about the most. Adaptive aids is a huge service that I don't know if it's always explained to the extent that it could be explained. So adaptive aids has up to $10,000 per year available. Now, have I ever had to put $10,000 on the plan? Only a couple of times, doing a vehicle conversion. So if you have a vehicle that meets, it has to be less than 5 years old and less than this many miles, you would talk to your provider about that. But you can put it on the plan, $10,000 to help cover the conversion to make it wheelchair accessible. So that's where I see we use a lot of money sometimes, but adaptive aids covers your eyeglasses, it covers multivitamins, it covers any orthotic orthotic shoes. It covers any kind of eating utensils, any kind of like CPAP. It covers hearing aids. Did I say eyeglasses yet? Just there is this huge gamut of things that adaptive aids covers. And I could never tell you the whole list. You can look it up on the Health and Human Services website, but you can also talk to your provider. So what I like to tell people is first, of course, to use adaptive aids, you have to get a doctor's order. You have to medically need it. Then you have to go through a DME or of some sort to find out, will Medicaid cover it? And if Medicaid will not cover it, then you can add it to the plan. Wheelchairs, if your wheelchair is only through Medicaid, you can only get a wheelchair every 5 years, but you can get a customized wheelchair and all kinds of different things because it's such a huge pot of money. If you would, like say your wheelchair breaks and you can't get another one, then you could add it to adaptive aids and get the wheelchair that you need. Some people use the money, like if you have no, I can't think what it's called, but it's really cool, but it's like this in ceiling like lift, or if you're in a wheelchair, you can put that in and then it helps you get throughout the house. It's like, especially if your parents might be aging and it's harder to do those transitions. So anyways, that's just some ideas on things adaptive aids can cover, from very small things to very, very large things.
Wow. On
the flip side of adaptive aids, we have minor home modifications. Be very careful with how you use minor home modifications because it's $7,500 in your lifetime. So you can never use the money again. And minor home modifications are used to install like permanent ramps to your home. It can be used to modify a bathroom, to make a roll-in shower versus the tub shower with the lip. It can be used for so many different things. So just keep that in mind, that money is there, but you would want to be careful not to put it in maybe a house that's being rented or an apartment that you may not live in long-term, because you won't be able to ever have it again. Other services are employment assistance and supported employment. Employment assistance is where someone helps you find a job. Us hired staff helps you find a job. Supported employment means that staff stays with you and goes with you on the job or checks with you on the job so that you can keep your job. So those are very cool things. We already talked a little bit about PASS-HAB and transportation when we talked about having a supported home living staff and your PASS-HAB staff coming into your home. And then the last one on the list is respite. Respite is like, I hate to use the word because we're talking about adults nine times out of 10, but respite is the equivalent of babysitting. When you need a break and you need to get out of the house, respite pays the worker or the family member or whoever we hire to come in and take care of your loved one while you take the break. The important thing to know is that respite only can be added to a plan if you choose supported home living. So if you have your PASS-HAB, you have your transportation, you can have respite. If you choose host home, unfortunately, it's a 24-hour, 7-day-a-week service, and the state looks at it as we're paying you. You would have to find your own assistance. So you cannot add respite to that plan. But if you do, and then of course you wouldn't need respite in the group home because it has the rotating staff. So that's an important one. Respite is 300 hours a year. So it's not a huge service, but it is definitely very helpful in some cases.
Very good. Are you ready for the next slide? Okay.
Yes. So this is just kind of wrapping things up a little bit. We know about our HCS slot if we have one. If you don't have one or you know somebody who has a special needs loved one, I just urge everybody, please share this information. Talk to people if I run into somebody in a grocery store, sometimes I'll ask, hey, I just want to make sure that you know about HCS. We have to help each other because, like I said earlier in the slide deck, there's no great information system throughout Texas to make sure that every family understands what's out there for them. And sometimes by the time that you know it and you understand it, it's not too late. I don't mean it that way, but it's a 15 to 20 year wait. That's a long time to have to come up with another solution.
Mm-hmm. I typically tell families that the second that they have any inkling, any indication at all that their child might have a disability, put them on the list, because you don't have to prove it until you come up on the other side 20 years from now. If you don't need it, you can let them know, oh, turns out we don't need that. But if you do, you're ahead of the game a little bit at least.
I say the same thing.
Mm-hmm.
So if you do need to apply, like I shared with you guys, this link right here, which Michelle will send that out to all the participants, but that link will get you to the list where you can look county by county for which LIDA you live in. Another important thing is, like, you guys are in Houston, the Houston area. There are 2 LIDAs that run right through Houston, Texana and the Harris Center. And there's kind of a line drawn. Now, when you are on the list, and this is any county in Texas, but in Houston, especially with it being such a huge area, a lot of people move from one subdivision to another. Well, one subdivision may be in one LIDA and another subdivision may be in another. You have to be really careful on your county and your LIDA. Make sure that you don't kind of mess up your place on the list. Definitely talk to them about how that may affect your slot space, because just moving from one county to the other, you wouldn't think it would affect your place on the list, but the slots are based on the size of the county and which county you live in. So if they transfer you, you could go up on the list, you could go down. I mean, it could possibly get you closer, but you really want to make sure you have that conversation if you're moving and you're on this list.
That's good to know. So there was a question about county, Rockwall County. So they're already receiving HCS, but does your company service, or we're going to talk about where you work and how to find you guys, right?
Yes.
Okay.
So this is my little slide where I say, if you want to be a host home, if you want to be a host home provider, you can reach me through this link, but then on the next slide, it'll say my name and my phone number, and I prefer a text anytime. Then the QR code is cute. It's what everybody uses these days, but I'm still a little old school. Just call me. We'll talk about it.
Perfect.
So,
perfect.
Our company is actually statewide. We do serve every county. We may not have a local office, but we can definitely get to you and help you with that. So if you wanted to send me a text, email, or call me, I could let you know which area office actually serves your town. I don't know off the top of my head, I'm so sorry, but I can make sure that you have that information, and we would love to help you with anything we can.
And then if somebody wanted to go tour some of the homes or opportunities that DNS Community Services offers, would they just contact you or their local people and set that up?
So, so I work from home and I live in Brenham, which is a little town outside of Houston. So I couldn't necessarily, tour you around the state. But we have an area office if we're looking just at Houston, which is probably where pretty much everybody is from. We have an area office in Spring, and we have an area office in Katy, and then they reach out through kind of the everywhere. So what I would do is get you in contact with one of those 2 directors, and then they would set you up for some tours of maybe, you could look at, a higher functioning home and kind of what the daily schedule looks like. Maybe you could look at what does a wheelchair accessible home kind of look like? What do we provide? So we could definitely make sure that you get that. So yeah, you can reach out to me and I'll make sure you get in contact with the correct person.
Wonderful. Like, So as I mentioned, we will be sending these slides to everybody who registered. So you will have Lynsy's contact info. We do these webinars 3, 4, 5 times a week. Some weeks we do webinars all the time. They're always free. And these are some of the things that we talk about. And I just have a few slides as we wrap up here. So it's the perfect time. If I've missed your question, or if you have a question for Lynsy or for me, go ahead and put those in the chat box as I finish up these last few slides. So we help families, with the future cost of care estimates, making sure that you're on the waiver program waiting lists and that you understand those. Your SSI, SSDI, Medicaid, Medicare, all of those government benefits that you know what they are, how they work, what the differences are, and how to apply. Places where you can keep money, we kind of mentioned that. Your ABLE account, your special needs trust, and making sure that your beneficiary designations are set up correctly so that you don't jeopardize those benefits. Lynsy was talking earlier about income and how those affects your benefits. Well, if child support is a thing in your life and your child receives that support beyond age 18 due to their disability, even that can be included as income, even though they're not working for it really. So you have to be careful and make sure that that is redirected to a first party special needs trust, which is a pretty simple thing to do, but we help people make sure that that happens. We help families look at what communities are available, what educational programs are available, what transition programs are there, what vocational options are there. We help you find those resources. We talk with attorneys on some of our webinars where they talk about guardianship and how that works and what you need to know about guardianship and the alternatives to guardianship. So there's really a lot of great information. You can see our upcoming webinars by clicking this link when you receive the slides later on today. That will take you to the upcoming webinars. Our past webinars all live on our YouTube channel. So of course we have a link coming up for that as well. Real quick, this is our team of experts. I mentioned it's Allison and her husband, Jeff. And then there's my glamour shot and my bearded man, Andy. We all bring our different areas of expertise to the table to serve our clients. We're an independent firm located just outside of Houston. We have 4 operations staffers who help with making phone calls and registering people and putting together these great webinars and making sure we have all of our paperwork turned in. So look at these smiling faces and please understand that one of these ladies is probably going to be reaching out to you by phone or email to see if you have any more questions about today's topic, or if you would like to schedule a free consultation with us. If you want to do that, you could use this QR code. You could call us or email us and set up that free consultation. These usually last between 30 to 45 minutes. We want to, first of all, answer whatever questions are keeping you awake at night. We want to learn a little bit about you and your family, and then we'll tell you how we work and what we charge and things like that, and see if it's a good fit for us to work together. We are very low pressure. We are here to help first and foremost. It's really in our hearts to help. So you'll find that our consultations are very chatty. They're not, very formal. It's just a fun time to get to know each other a little bit better. And then this slide also includes, like I said, the link to our Facebook, Instagram, the YouTube channel where all of these webinars live, and our podcast, which we've started doing just a few months ago, but we've been putting all of our webinars there as well, in case you prefer to listen instead of watching us. So again, thank you everybody who has taken the time out of their day to be here with us today. to Lynsy for presenting all of this fantastic information. You've done a great job. And if you have any other questions, please feel free to reach out to Lynsy for questions that pertain to her, or to me for questions that pertain to Consolidated Planning Group. We are here for you. We're here to help. All right. Thank you, everybody. Enjoy the rest of the week. Lynsy, thank you for being with us today.
Yes, thank you for having me.
And I hope you feel better soon, Lynsy.
No, I'm good. But those were the wrong slides.
That's all right. That's all right. Thank you so much.
It threw me. Oh my gosh. Better at the end when it's over. Sorry. It threw me off right at the beginning, so I apologize. But I was like, oh goodness.